What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how to avoid injuries in this beautiful world of radiology. So, to give you context, I'm a night shift Xray Tech. I've been doing it for over 4 years at a Trauma 3 in the great state of Texas. So, the injuries, the very physical, both from you placing the board and the patients falling onto you, or sliding people, or even in some cases hostile patients. All those fall into casualties that it can affect you. I've been threatened by patients that I will bite you, I will hit you. I've been swung at by babies, by grandmas who were 96-year-old that had dementia. I have never been physically hit, but I have been swung at, or I've been threatened both verbally and physically at work. So all that comes within the job. So I will say overnight there's been more, because at our hospital we have, we're like the county hospital, so like we can't say no to nobody. So like we get homeless, we get aggressive, we get jail people, we get everyone there. So we deal with not the most easiest of patients, which there's been times where I'll go to the trauma room and the nurses are all there like, good luck, Miguel. This is one of those hostile patients. Hope you don't get hit. So we'll see how that goes. For anyone joining our profession, it's not just the walkie-talkie, just pushing the button and getting out there. It comes with different stories and different tales. But anyways, I would say for heavier patients, try to have 2 techs at least to help. The most I've ever had to use at our department was they wanted a hip on a heavy patient that was like pushing the max of our limit. And it was 1, 2, 3. It was like 4 techs, transport, and then I forgot how many. It was a lot of people and some nurses just to get those pictures, just for it to come like shit, like the pictures to come out like shit, because we've told them like it's not gonna look good. But like there's like, you gotta know your limit, because they will order stuff, and if sometimes you're like, hey, I can't do that, or hey, this isn't gonna be optimal, maybe put CAT scan or do some other tests. You will go through a bunch of things that are unnecessary just to get yourself hurt, or even transferring patients. If you're not at the bed and the stretcher aren't in like the exact same like height, or maybe you're overstretching, there's so many times where you can like hurt your back out. Or even getting the patient from the wheelchair to the table, you got to be careful too, because sometimes patients be like, oh yeah, I could stand, I can shimmy on over to the table, and then as soon as they step up, they start feeling dizzy, or and then they could like lean forward onto you. Anything can happen, and it can get you hurt. So you always, try to avoid injuries and stuff like that. I've noticed more when it's like the students who are at the hospital and they don't know how to drive the portable. You gotta be a little bit careful. Your toes, or maybe the swinging of the tube, could get you hit. But that's, you might have to be quick on reflex, or just be paying attention. So I've seen a few techs of ours get hit with the tube, or they don't see it. Or I've witnessed, because like in the trauma room, we'll place the board, and like the patient started coding, and one of the nurses started compressions, and our tube was right above it, and we didn't have enough time to swing the tube out or to move it out the way, and they got hit in their head pretty good. But thankfully they were okay. But it was, a casualty within our department, to always be careful with the tube and stuff like that. But overall, I've never been hurt at my job, but there's been times where, like, I'll like move someone and it feels like when I work out my back at the gym and I'll leave the work sore, but I've never pulled anything. Thankfully I've been pretty good, but sometimes you'll move people and you're like, damn, I got a good pump onto this, like. But thank God I haven't been hurt or nothing. But there's been a few times where mainly our CAT scan department has gotten hurt, where like patients fall or they've messed up their like shoulders and needed surgeries, or I think someone messed up their knee and needed surgery too. But it might have been like they had issues and then something happened at work that just kind of pushed them into needing surgery. So you try to be careful, try not to overdo it. Always know the limits of you and your table. Always work smarter, not harder. That's what I tell anyone who's joining our profession. Because if you don't take care of yourself, you will get eaten up by like this world. And always the patients, some of them, they will help you. Other ones, just because they're at the hospital, maybe they can do it, maybe they can't. I don't know what's going on. Certain patients, just because they're there, they'll be dead weight, won't do nothing. Some of them, it's understandable. They're intubated or they have something broken or they just can't. But other ones, you can tell they just aren't going to do anything to help you. And there's something called like we call it the waffle. I'm not sure what the exact medical term is, but it's like a cushion that you can slide the X-ray board under. Certain beds, like the trauma beds, are pretty easy to maneuver because you just slide it in. You don't even got to move the patients. Highly recommend those. Other places, they have a little slot for your X-ray board, and once again, makes it easier on you, but I know most places don't have that. So, but the little, cause I guess like a little, like an air mattress type of deal. But you got to be careful with those. It does make sliding the board really, really easy. But if they're heavy and too much weight is laying on the board, it may cause like little rings and circles to show up, mainly for on the KUBs, because there too much weight is on it. So you have to be careful when you're checking your images to make sure none of that shows up. But that is way to like reduce you getting hurt at the job, working smarter and stuff like that. Let's see what else. I would say, because I run 7 on, 7 off, on like the last 2 nights, I find myself, since your body's more tired, that you gotta be a little bit more careful, because those are the days where I tend to leave work more sore or more like you almost got, because sometimes you'll do something and you'll feel like your body's like, oh, I almost got hurt. Don't push the board too hard, or don't pull the pain, because you about to get hurt. I don't know how to explain it, but like there's like a feeling or a little like you feel your body pushing to the brim, and it usually happens on those days. So anyways, that's all I got for you as far as, avoiding injuries at work. Hope you enjoyed today's video, and we'll see you on the next one.